All right. Thanks everybody for joining us. Happy Friday. I'm glad that you guys could pivot in a bit because we normally do these on Mondays, but we're doing these on Fridays. And if you had other plans for your Friday afternoon, hopefully we'll make this a little bit fun, a little bit ruckus, and a little bit, I don't know, informative. That's right. Informative is what this is all supposed to be. For those of you that don't know, my name is Tony Young, Tony Young. I am the founding executive director of Community Education Group. And we work here in the Appalachia region doing work in economic development, workforce development, HIV, viral hepatitis, substance use disorder, and what else the kitchen sink asks us to do on behalf of the peoples. Today, I'm super excited to have conversation with my good friend. She always says she tries to deny it, Beth. But I know you try to deny it, but it's sad, but it's true. And then we're going to also we have representative from HRSA, and I'm going to let them introduce themselves. And what we're going to talk about really is where we are with HRSA, where we are in rural health, and what we need to be doing with the Office on Rural Health. And I think that what the good news is that we know is that they're not going anywhere. So we're going to be bugging them for the next 4 to 6 to 8 years. So I'm going to start. Beth, what do you do at the office, the Virginia Rural Health Association? What do you do over there? Y'all
I'm
do?
not sure I need to tell Jillian. I've known Jillian for a while.
Yeah,
Well, you got to
So
tell. You
good
don't
to
have to
see
tell. You
you.
don't have to tell her, but you got to tell all the other people. We got other
sure.
people.
So the Virginia Rural Health Association is a statewide nonprofit advocacy organization under the umbrella of the National Rural Health Association. We work to improve health and health care for the 2.5 million people who call rural Virginia their home. We have a number of projects going on in addition to what we're doing with Tony's office. We have workforce development, we have health equity, we have a number of substance use disorder grants, we have our Pride initiative, and of course, working with our elected officials to make sure they understand how the decisions they make affect health and health care in rural Virginia.
Well, is that all you wanted to say? You can slow it down. We got a whole hour. You know.
Nobody needs a whole hour at 2 o'clock on a Friday, Tony.
Well,
Nobody, nobody.
I didn't want to say that, but then then I would feel like I wasn't doing my job if I was like, okay, I'm really trying to get out of here early today. But no, no,
The
no.
elevator speech moves fast. It's a fast elevator. It's a speed
I mean,
elevator.
you know me,
Express.
I could go into my whole train analogy, but I don't think anybody needs that today. Jillian, it's a pleasure to meet you. Would you like to tell the good people here what you do?
Yes, I can say this is going to be a fun call. Hi, everyone. My name is Jillian Causey. I serve as a division deputy director in the Rural Strategic Initiatives Division, which is located, of course, in the Federal Office of Rural Health Policy. So what we do is we are a grant-making agency, as I'm sure many of you know, and so we work to combat the opioid epidemic through making these grant awards. Our office in general as well, we also review policy, and we just try to make sure that any new policy at the federal level, we try to provide insight into how it may affect rural communities. And so, yeah, like Beth said, I've been with FORP for I think about 6 years, so I'm pretty familiar with her and other a few other names I see here. So it's just good to be here and see everyone.
Well, perfect. One of the things actually maybe we could spend a minute talking about is that giant behemoth of a newsletter that comes out of your office. How often does that thing come out? And can we make sure we get a link down in the chat to make sure that everybody can sign up for it? Because I tell you, it's like the tablets in the tombs, but there's a whole bunch of information buried in there. And I know, I just want to give a shout out to it because I find it one of the things that I think some people sleep because it's not only educational and informative about kind of what's going on, not just in HRSA and not just in your office, but across a whole of government approach on rural issues, which
Yeah.
I really appreciate. But the other thing is that there's technical assistance tools in there. There's grant making opportunities in there or granting opportunities in there. So can you talk to us a bit about that thing, how you sign up for it, how you might, if people have like a thing that they're doing in rural communities, how they get it in there? Tell me about that thing.
Yeah, so our FORP announcements, they're weekly. They come out every Thursday morning, albeit any kind of holidays or anything like that. But yep, every Thursday. And you covered really what is in those newsletters. And I will put in the link or the link in the chat. But in order for you to sign up, you kind of just really go to our website and fill out your information. And I'm not quite sure how you would get something in there, but that could be something that I could follow up with. Because I think for most of them, they tend to be more like federal resources or federal partners, but we can definitely figure that out for you and see if there's a way for that. But yeah, it's really comprehensive. It's just we even pull from it for grantee calls as well to just make sure that the information is getting out to folks. But yeah, to your point, it's not just HRSA or the Federal Office of Rural Health Policy. It's USDA, it's SAMHSA. So it really is an effort that we spend a lot of time on every single week to just make sure it's updated and full of the necessary information. It also has the policy perspective in there too. So it just really is a great resource for everyone. So I'll put the link in the chat.
Now, Beth, what are your priorities out of the Virginia Rural Health Association over I guess the coming 6 months to a year?
So some of our major priorities, one, we're working hard to find funding resources, whatever, related to maternal health, especially in Southside Virginia, where the maternal health outcomes are just horrific. We're always looking to do more in relationship to substance disorders. We are trying to find some stable funding for our Pride initiative. We've gotten little buckets of money here and there from a variety of entities, including FORP, but need something more substantial to go forward. We currently have one of the public health workforce grants and are trying to figure out what we can do to continue supporting people who want to go into entry-level health careers once that grant runs out this summer. But with that, we're always looking for opportunities, possibilities, partnerships, anything that we can do to help strengthen the system,
Right.
help people.
Right. And Jillian, one of the things that I'm sure some of the people here are wondering about are kind of grant making opportunities or grants that would be coming out of HRSA. But I also wonder, are there technical assistance and training opportunities which may help folks build up their infrastructures more that come out of your office? Are there things that are coming up on the horizon that would be of value, particularly to those groups that are in rural communities?
Yes, so for fiscal year 25, we actually have the Rural Communities Opioid Response, or RCOR. I know many of you are familiar with that. The Overdose Response Grant is forecasted to begin in September 2025. So the application, I believe, comes out sometime in early January, February. That part it's on grants.gov. But that grant is a 1-year, $300,000 award, and it is to support the immediate responses to the overdose crisis in rural areas. This is an award that we've funded in the past, and so we are going to be doing it again. And this is really about trying to improve access, improve capacity, and as well as create sustainable programs in rural communities to prevent, treat, or offer recovery services to folks who are struggling with substance use disorder. So that is one of our main ones that we have forecasted at this time. For TA resources, we also fund the RCOR, TA center or TA portal. And I can send the link for that in the chat, but it is primarily, of course, for our active award recipients, but all of the TA resources are actually on the website, and they are, paid for by federal dollars, so they are free to the public. And they have a plethora of resources. They have toolkits around, billing, coding, sustainability. They also have, if you need more insight on, workforce or peer support, services. So that would be a really great resource, as well as, of course, NOSOR, right? The National Organization of State Offices of Rural Health is a great resource, TA resource that is very state specific. There is a SOAR in every state, of course, as you all know. We also have 3RNet, which is a great resource for workforce and really trying to connect the dots, for maybe some of those vacancies or retention that, folks may be having. So those are the top ones that come to mind. But if folks have, specific questions, I'm happy to answer those
Well,
too.
well, Jillian, let me ask you this. What if you were an organization in, I don't know, Ickatabicka, Tennessee, right? And you're out there and I'm struggling. I mean, I will get on my bandwagon in a minute about the office of the rural health calculator. I'll get on that in a minute, but and then you can tell me to jump off of it. But if I'm out there in Ickatabicka, Tennessee, why do I call your office? Why do I look your office up online? When I say, you know what, you should call Jillian in Ickatabicka, Tennessee. Why are they calling you?
I think they should call us because we really try to, well, we do say we are the voice of rural. We are the biggest, agency or organization that is primarily focused on providing resources to community-based organizations in rural health, right? Like I know sometimes there's state resources, but the money is actually going to the community. And the things that I love about our program the most is that we are very focused on you as the grantees, right? You as the folks that need that help, what's best for your communities. And so we really try to create grant programs that are flexible, where of course we have our parameters, but it's really about you letting us know like, hey, this is really the need. So one of the programs I think about is our child and adolescent behavioral health program, right? And that program, of course, is for children and adolescents between the ages of 5 and 17. And so the primary focus, of course, is prevention and education, but that looks completely different in every single one of the 9 recipients that have that funding. So I think you call us because, we want to help. We want to make sure that the money is actually useful and can make impact. And so we do that through the grant funding of it, but we also try to provide the TA support. You're not doing it alone. You have, those resources. And you have access as well to, you have access to the resources, but you also have access, I think, to a project officer who has a lot of that kind of like subject matter expertise, understands, what is required at the federal level. And yeah, it's just a team of people that help. So I think that's my spiel on the office.
So let me ask both of you this question. So I'm the same organization, but I'm now in Ickatabicka, Virginia instead of Tennessee. Can I call you to get technical assistance to help me write my RCorp grant?
HRSA does offer a few resources for understanding the federal grant making process. I wouldn't say it's as specific as we are going to tell you how to write your grant, but we do. HRSA has made a really big effort to kind of parse down our notice of funding opportunities to make them easier to read, easier to understand. So that is really one of our efforts as well, to really address the equity of our process. And in every funding opportunity, you have a point of contact. There is a webinar that we host that is recorded, that walks you through the NOFO, that walks you through the requirements. We oftentimes create FAQs. So we really are trying to make it easy to understand, so that the folks that need it the most can apply.
Okay. Beth, what about you? I'm going to call you. Can you help me write my HRSA grant?
Are you paying me to help you write your HRSA grant?
Absolutely not, because you're going to do it from the goodness and the kindness of your heart. because
Oh,
I'm broke as a bag of
oh,
glass over here.
Tony, my
I'm
heart
broke
is
as a bag
that
of
big.
glass. I'm broke as a
I
bag.
will encourage you to send staff to the no source grant writing webinars. Those are awesome.
Uh,
I make
to
all
the
my
what?
staff
To
do
the
that.
what? Say that again.
The National Organization of State Offices of Rural Health, and I'll dig up the web link for you. Once or twice a year has a webinar series. It's maybe like 6 webinar meetings over a course of 3 months or something like that. It is excellent for grant writers, especially people focused on rural health. I make all of my staff do that one.
Okay. Hillary, do you hear that? We should probably make everybody on our team do that. That's Hillary on our team. I'm just saying it. So there you go. All right.
See if I can find a link.
And I mean, one of the reasons why I asked that is because I think that that's one of the greatest challenges for small and mid-sized organizations, particularly those out in rural communities, is that a federal grant can be a daunting thing. It can be a daunting thing for an organization of our size and age. To really to have the time and to have the bandwidth to do it. So I think that then what happens is that what we lovingly refer to as beltway bandit firms seem to can sometimes be the ones that get those resources rather than the organizations far out in community that are actually doing the good work. So I think that the idea of kind of having that sort of boot camp or having that sort of opportunity to learn how to write those grants is good. I know that we have we have a grant from CDC that is a capacity building and training grant, but that doesn't necessarily allow us to quote unquote write grants for folks. And I think that folks sometimes just need grant writing support and technical support in that realm. So the other thing is that now let's talk about one of my favorite subjects with HRSA. The rural health calculator. Help me understand how we can get rid of it and blow it up and have it be seen no more. Go ahead.
Are you speaking about the rural health eligibility analyzer?
Yeah.
Okay,
Yeah.
Just wanted to make sure okay.
Yeah. I call it a calculator because that's what it really does. It's sitting there calculating how many people are someplace and that's what you use population data to come up with it, right? And do I remember this right?
Yeah.
That's what I thought. It's calculating. You counting people.
Heck, I'm not complaining. It used to be much more restrictive than it was, and Steve Hirschman to push the edge on a bunch of those limitations. It used to be that Craig County, Virginia wasn't rural, which was like, have you been there? They have one stoplight.
Right. And so, and Beth, how did you? So, tell me your experience with the rural health count. Now, I'll let Jillian prepares her answer for me because I could stay on this one for another 40 minutes.
I can be more blunt than Julie can. Julian's too nice to.
All right, go ahead.
No, so anyway, I just that's the limitations they give us. Then that's the limitations they give us. I mean, I needle them all the time about it, but we apply for what's eligible and go from there.
But what do you? But do you think? Okay, let me just. Let's help Jillian along here. Do you think there is a value to the rural health analyzer to folks actually in rural communities? What's the purpose of? What's the benefit of?
In terms of defining what's rural and what isn't?
Yeah.
Yeah, honestly, it's along the lines of you got to draw the line somewhere. I mean, every government entity has a different definition of what rural is. Somebody, who is it? Is it CDC? Somebody else? It's anything under 500,000. Oh my goodness. American Heart Association, bless them. It's if you call it rural, that's close enough for me. I love them. They're my favorite people. But I just whatever parameters you make, someone's going to be annoyed about it. And I can tell you that there are middle to small sized towns that they'll fight in tooth and nail to not have that rural designation because they see that as a bad thing. They don't want to be rural. They don't want to be called rural. They see rural as a negative.
Why would somebody see rural as a negative thing?
Oh, Tony, because we're all poor and ignorant.
Oh, my fault. My fault.
I don't have shoelaces or anything.
Well, that's because you can't tie your shoes. That's a whole different can of worms.
For real, I do have flip-flops on today. No,
Okay,
it's
Jillian, don't Jillian, you
yeah,
hopefully somebody warned you before you got on this call about us.
They did not. So,
Okay.
but no, I'm
I'm
having
sorry.
fun.
Okay, sorry.
No, but
Somebody should have warned you. I apologize.
no, it's okay. This has been great. No, I mean, I will say we know it's not perfect. We acknowledge that, and I think Beth has a good point. It is something that we hear the concerns. We update it. We look at it. I shouldn't say we update it, but we look at it every single year to just try to make continuous improvements. Um, and I think from the federal perspective, one of the reasons that we do keep it, to Beth's point, is we really try to keep those parameters in place, and really try to maintain the integrity of what a rural community is. So we are always open to the feedback and the suggestions to make it work the best for you all. So please feel free to continue to let the office know.
Is there a way to what's the word I want? Is there a way to challenge the determination, I suppose? Right? Like if I put my zip code in, so let's say it's R Corp time, and R Corp says you gotta be rural as defined by the analyzer, and I say, all right, I put my zip code in and it says no. But if I put my neighbor's zip code in across the road, they say they are in. So is there a way for me to say, hey, I am actually rural?
Yes, I mean, I think that again, those are ongoing conversations. What I would say is, if a grant opportunity is arising, that is probably not the time to say that, because it's a very short timeline to apply and all of those things. So I think it's just a continuous conversation that you should have. And of course, we have our guidelines for how we define rule, and so we do have to adhere to those. But there, to your point, there have been folks that have emailed Steve Hirsch or emailed the office, and we've investigated and tried to accommodate. I'm not saying that that's the norm, but again, we try to be adaptable as best we can.
Right. Now, one of the things that we most of us on this call do work is in the, you've got the R Corp grant, but most of us actually do a lot of work in the recovery space, or in the, substance use disorder space. Can you tell us a bit about I know I heard about R Corp, but what are some of the other either trends or things that you're seeing in rural communities around substance use disorder, but also substance use disorder, and in my brain, and I don't know why it comes up, but also in the reentry space as well?
So for the reentry space, I mean, I think we've seen a lot of a shift, particularly for those that have FQHCs. Now kind of really being able to treat or better treat, those populations before, that they weren't able to before. And so I think we're seeing a lot of reimagining of the services, and and services once people are re-enter society, but also the services being provided within, the jails. And so we are, to that point in particular, we are, still kind of seeing some stigma there, but we are really trying to work with the local communities and grantees to provide them some resources, from the TA side of things to combat that. I think for recovery, I'd have to think about that. I think it's something that we've made a lot of inroads in the prevention piece and the treatment piece. And so I think we are trying to, a lot of our programs, we are trying to cover more of the recovery piece, because we see that that is something that we could invest a little bit more in. So I think it's something that will be seen. Our new program that was just funded in fiscal year 24 back in September, we kind of have labeled it as a one-stop shop. And so it's something where we want those grantees to be able to offer those like referral services, right? And really bring in the whole of community approach, so that they can really focus in on recovery. So I think that's where I would say for that, but if there's anything more specific, I can answer that too.
What about you, Beth? What are you seeing like kind of the overlap in this kind of reentry recovery space?
Yeah, the big thing we're looking at in this area right now is housing and finding ways for people to, if they go through like a 30-day residential treatment program, then what? And finding appropriate housing. I have this pipe dream that I'm going to find funds to rehab every abandoned elementary school in Virginia and turn it into a long-term recovery housing project. Don't tell my board they'll have a heart attack. But that's our big thing in mind these days. Housing, transportation. I never could deal with transportation. That's a lot of it.
Well, I mean, I think that's it, right? I mean, when Kennedy did his poverty tour through the Appalachia region, he said that he felt like we could get folks out of poverty, or particularly in the Appalachia region, if we really focused in on three things. And those three things included work on transportation, health, and education, right? And so if we could get people healthy, we could get them educated and provide transportation, which is, kind of why we have so many highways that and literally lead to nowhere. But we got to figure out how to get those folks access, I think, to short and long-term housing. And we see in West Virginia, for example, more kind of for-profit recovery institutions coming in to provide 30-day or 28-day treatment, but there's not any short-term or long-term post recovery housing. We too, we've got buildings that we're trying to renovate, but the question is how do you resource those renovations to be able to provide that sort of recovery housing support that's needed? So now, Jillian, you're really on the spot. Where is HRSA have any money for us to build all of this recovery housing that we need in rural communities?
So I was actually just to Beth's point, we actually have 3 centers of rural excellence. They are funded by HRSA, so they don't necessarily provide funding, but each of the 3 centers, they each focus on prevention, treatment, and recovery. And one of the ones that focuses on recovery is actually based out of Kentucky, and they're the Fletcher Group, and they focus on recovery housing. And so they give you a lot of great information, like resources, tools, training about how to develop, recovery housing in your communities. And so they're really like thought partners. Yes, thank you for putting that in the chat. But that would be a really good resource. And again, our programs are flexible. So if that is a need of your community and that is the avenue of recovery that you want to kind of focus in on, so long as your program idea were to meet it, we would more than likely support that.
Right. And okay. And so could we go to the Fletcher Group and say we wanted technical assistance, not just us, but anybody on the call, that we'd like some TA on our recovery housing project?
Yes, they could be able to help you.
Lee and Lavina, I hope you heard that. And so we should be reaching out to the Fletcher Group to provide us some TA for our housing project down in Charleston.
Yeah, I think even once or twice a year, they have like workshops you can go to and get more information. The other conversations I've been having, I've been talking to folks, again, with my idea of trying to renovate stuff, I've been talking to folks at the Federal Reserve and see if we can't figure out a way to cobble some funds together and do something.
But maybe that's a conversation we should do with one of the APC meetings, is talking about how do you pay for recovery housing, right? And getting some of those folks in here to really talk about it, because I think it's not just West Virginia that we're seeing it, but we're certainly seeing it in Kentucky and Ohio as well, that where organizations are coming in particularly for-profit organizations, are coming in to provide the recovery portion of it, but not to provide the recovery housing portion of it. And I think that many people are concerned that, you know, you could take an individual and they can be in short-term or long-term recovery status, but if you're sending them right back home, after that, then does the recovery take in the same way if they have a short-term bed or even a long-term housing bed? This is where you say, no, Jillian, you didn't know. This is where you go, no, you're right.
No, you're right. Yeah.
That's all I needed. Is it really, they should have prepared you for how crazy this. So what I try to
Now I know.
and but what we try to do is to always tell people that this is like having a cup of coffee with me, where I ask you all of the things that I need to ask, but that there are 30 people watching. So that's what we try to do this, because, you know, so many people don't believe that they don't have access to people like you or people like Beth. And what we want to always do is to have access to people like you and have access. You know, I mean, because so many people think that government is this big amorphous thing, this big bureaucracy, and it's not made up of people. And I'm like, no, there are people that are there that are working on our behalf that really want to give us the information that they have, and we want to provide a way to get that out to them as quickly and as much and as often as we possibly can. And so that's why what we do also with these links is that we will put out a whole link out to everybody who's on our mailing list. So it's not just the people that are here today that will get this, and we'll be able to send this out to our entire mailing list. We'll include a link in our newsletter. So there'll be people that'll probably be bothering you, and you'll say, where do these people come from? It'll be from here. But also it is opportunity to develop partnerships, collaborations, and mobilization opportunities.
Yeah.
Beth, what is VRHA doing in the next 6 months that we should all know about? You got a town hall meeting, you got a video.
Well, we've got a conference, of course, coming up in a week and a half.
You do.
You better know that. Lee's talking.
Is he talking? He didn't tell me he was going. I'm not approving that time off. Tell the people about your conference.
Yeah, so the Virginia Rural Health Association has our annual Rural Health Voice Conference in Abingdon, Virginia. Yes, CG will be there. November 19th.
I love that place.
And 20, yes. In fact, the same place, Tony, where we had that forum, when was that, last spring? I don't remember. Lee's laughing at me, or us probably. Lee's probably laughing at both of us.
So, because like it's a Friday afternoon, right? Like I feel like we're all having fun today. CEG is actually going to be at 3 different rural health conferences in 2 weeks. So I just want to remind our fearless leader, A. Tony Young, and the rest of the team. Tony is also going to be presenting at the Tennessee Rural Health Conference at the same time. So big week for rural health across Appalachia.
Yep. November 21st is National Rural Health Day. So that's when a lot of the rural health associations have their annual events. So hang out in Abingdon with us if you can. Go to Tennessee otherwise. Whoever else, probably West Virginia's having theirs too.
Beth, are you having any, how much of this is also, is there a virtual option for any of the stuff that you're doing?
No, we decided COVID was enough of that.
Okay. All right. Okay. Cool beans. Michelle, do you want to talk? Because Michelle, you've been firing up the chat. Why don't you just come off camera and say who you are and tell the people all the things that you've been doing.
Hi, everyone. Michelle Herman. I'm one of the project managers at the Recovery Center of Excellence. We're one of the 3 centers of excellence under our corp, and our focus is on prevention. Which is why I've been dropping in a lot of the information about our Corp TA, as well as the, I always butcher the name and I shouldn't, the Rural SUD Info Center, which is a kind of storehouse for all of the resources and materials that the Centers of Excellence have put out over the last 5 years. And you can request technical assistance from any one of the centers right through there. I also dropped in some information from the Fletcher group as well, and I can drop in our website too. as well as the University of Vermont's Center on Rural Addiction, CORA. And so if there's anything, and CORA's focus is on treatment. And so if there's a way that the centers can help, please, please, please just reach out. We're happy to help in any way, shape, or form. Like I said, we have this, huge compendium of resources on the Rural SUD Info Center, as well as our individual sites as well. There's toolkits and resources, and if you need help with piloting things, implementing anything, we're currently kicking off a lot of our new pilot projects right now with youth focus.
What do
Youth...
what you used a whole bunch of words there, Michelle.
Yeah, I'm sorry. What do you mean?
What do you mean? That was a lot. You made me scratch my head. You're what? You're kicking off a pilot program. There's a whole bunch of what?
We're kicking off. So our center, we are doing a lot of pilot program projects for the center that have a prevention focus. And what that means, so we have some projects that are focused on trauma-informed care for youth. And
so
what we're doing right now.
Does that you know me well enough to know I'm going to interrupt. So yeah. You know how this goes. You know how this goes. Nobody won poor Jillian. But so here's the thing. So all right, so you kicking off a trauma-informed care thing. Does that mean I could come get trained on trauma-informed care, or that you have a program on trauma? What is it? What is it? Talk to me like I'm 2.
Yeah. So what we're doing right now is we're kind of in the information gathering stage. So we are going into communities and listening around what their needs are. And from there, these projects will take that information and then develop a program that would best meet the needs of the communities that we're working in, to actually roll out programming and interventions or resources for each of the 5 pilot projects that we're working on. So the trauma-informed care one is one of the 5 pilot projects.
Okay. How do if I want to get involved in that, what do I do?
Absolutely. All you need to do is drop us a line from our program assistants. There's if you scroll down about halfway down there, there's a request form. Just fill that out and somebody from our technical assistance team will reach out and get connected with you. Most likely our outreach coordinator, her name is Carolyn. She's absolutely fantastic.
And she'll respond to my email?
Absolutely.
I mean, yep. And what do I do if she doesn't?
You can send me an email and I'll respond to you.
Yeah, okay. I'm making sure. So you were picking up what I was putting down.
Yes, ma'am.
All right. Okay. And so what we'll do is, Lavina, if we can make sure we get all of these links and have one of the interns kind of write a little overview of what each of these are, and maybe we could even get that out of Michelle directly, so we can just put it in the newsletter, cut and paste, and we don't, because sometimes I make up what I think something is, just because it suits me, and we don't want me to do that with this. I don't think. What would you say, Michelle?
I am happy to share all the information with Lavina. I'll send an email, kind of give a high level overview of each one of our projects, as well as our flyer.
Perfect. There you go. And Jillian, do you have something like that too, like a program overview? I know we've got the newsletter link that you have, but like some of the overview, maybe even a link to grants.gov or where HRSA grants are, that kind of thing, because that way we can just kind of truncate it and put it in the newsletter so folks know how to get to it.
Yeah, we have a website that has all of our active grant programs, so I can post that, and then I'll also put the grants.gov link, and you'll be able to see forecasted opportunities for the next fiscal year.
Okay, Beth, do you have a link that you want us to push out about the conference or about something else that you're
Oh,
doing,
I
I
can
mean, I
always
know
do
we
that.
have 15 million collaborations, but you know,
Woohoo. Yeah, so I'll look up the conference link, but also I posted a link to the Rural Health Information Hub. If you aren't into them and if you aren't getting their newsletter, you are missing out. Those people know everything about everything.
all right. And that, because they also have I know on the hub link, they also have grants that are listed there too, HRSA grants and other grants, both public and private, if I recall correct.
Yep, that's pretty much our main source for anything about anything.
Okay, all right. And so does anybody have any questions for me? Because we might be able to get 20 minutes of our lives back on a Friday, and I might be able to eat lunch.
Lunch.
Oh, Beth, can I ask you a question?
Of
Why
course.
you have on flip-flops?
It is 76 degrees here.
Well, you got on a sweatshirt.
I'm weird, okay? Just deal with
I
it.
wasn't supposed to point that part out.
You know, Tony, you say what you want to say. I may or may not answer you.
Oh, someone put in the chat. Someone said, ask Tony about the last time she saw Gail Manchin and what shoes she was wearing. She was wearing a Via Spaga pump, and it was a whole big thing. But I just needed to know what the shoe was made out of, so I asked her to take it off so I could see it.
You would do that. Okay.
And she did. She did. It was and it was a Via Spaga pump. I knew that's what I thought it was. I thought it was a Via Spaga pump. I really like shoes, Beth.
In that we are in agreement. My shoe closet is impressive.
My shoe closet is pretty big. Sneakers and other. All right, everybody, listen, Jillian, please stay with us. Please, hopefully you'll come to the Syndemic Summit, which is oh, Beth, have they given you the news?
I have the date. I know I know it's going to be at the Greenbrier again. Did we block out dates yet?
It's not.
We don't have. It's not Greenbrier.
It's not the Greenbrier. We're gonna move it. It's gonna be I think it's gonna be the 19th, 20th, and 21st of September. And I believe September, and it's gonna be 3 days, not 1 day.
18 through 21 of September. I'll have to decide if I love you that much. That's my birthday.
You do love me that much. You do. You do love me. You love me more than most. I can't give you the location yet because one of our partners has told us not to announce the location yet. We will announce we'll announce the location hopefully in the next 30 days. But it will be in West Virginia.
Cool.
Yeah. It will be in West Virginia, but we cannot announce said location.
But not the Greenbrier.
But not the Greenbrier. And because it's going to be 3 days, we also think it'll be more accessible to where we're hopefully gonna host it. Have a meeting, I think, in next week, which hopefully will answer the question of if we're gonna get the location I want. You know me, I'm trying to get butter out of the duck. So, all right, Jillian, don't let anybody tell you not to come back. You can anytime.
This is the best meeting I had all week, so thank you so much for allowing me to be here.
Thanks. Did you watch 90 Day Fiance at all?
I do, actually.
Jillian, welcome to the fold.
It's a great show.
Who's your favorite couple?
Oh, what's that one couple? What the guy that they went? Where are they at? In Kenya, maybe? You remember that couple?
Which one? There's Michael and there's Michael. Michael. I think it was Michael in Kenya. Michael and what's her name? She's in Georgia.
No, he's from the States and she's in.
Oh, is this season's couple?
It's this season, yeah.
Okay, the guy with autism.
Yeah.
Okay, yeah.
Yeah, they're
Did you
funny.
see when he tried to tell that lie about I don't know what you're talking about, and she's like, don't do that.
Yeah, and then he's like,
even the producer was like, you told that girl you.
And he doesn't even really want to be married, so I don't know.
Right.
She got her hands full.
Now, Tiger Lily's my favorite. Tiger Lily's my favorite this season.
She's great. Yeah.
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 So-
I like her.
Yeah. So, and who's your best? Are you new to this? Or are you true to this?
I'm true, but took a couple seasons off.
All right. So what's my favorite couple of all time is Brittany and Yasan. Brittany from Florida and season 4, and Yasan was in Jordan.
I have to look at I have to Google.
Season, you gotta go see. Google it. Season 4. If you haven't watched that season, I'm gonna tell you. If I've given you nothing else today, other than 20 minutes of your life back, I'm gonna tell you, watch season 4. Brittany and Yasan. There are just moments that are unbelievable.
Okay. I trust you. I'll look it up.
What can I do? All right. And if you haven't done it, watch Sister Wives. Catch up. All right. Goodbye, everybody. Have an amazing weekend. Thank you so much for taking time out on a Friday. Goodbye. Good luck. Beth, have an amazing conference.
Thank you kindly. We're gonna have record attendance this year.
Yeah, I believe you. I'm shooting for 1,000 people at the Syndemic Summit this year.
Woo, that'll be fun.
That's what I'm shooting for 1,000. Yeah. All right. Okay. Talk to y'all. Bye.
Thank you.